Let's talk muscle injuries and the common ones that occur. So first we're going to start with muscle strain. Muscle strain is when we have overstretching of the muscle, and we characterize them by the severity of injury. So we're referring to this as mild, moderate, and severe. Sometimes this is referred to as grades 1, 2, and 3, or first, second, and third degree injuries. The book uses first, second, third degree. I think you're more commonly going to hear grade 1, grade 2, grade 3. So we're going to talk about mild, moderate, and severe. We're referring to grade 1, 2, and 3, or first, second, and third degree. So with that said, the first one with grade 1 and a mild injury is when there's no structural damage to the muscle, but there's overstretching. So anytime there's a muscle injury, there's a great blood supply to the muscle, which allows it to heal very efficiently. However, it also means that we're going to have bruising and tenderness to that area quicker than we would probably with other injuries. So for a grade 1, we're not going to have, I always imagine it being like this. You're not going to really have structural damage. You're not going to have tears of these muscle fibers. They're just going to be sore. So locally, when you touch it, it might be tender, or they might feel some tension or some tight spots. It usually won't affect overall performance, but it will affect them a little bit. They're not going to feel full 100%, and they're going to have some issues and some complaints. Where a grade 2 is usually the moderate, where we're referring to, this is probably the biggest spectrum here, going from grade 1 to grade 3. So you're going from no tear at all to a full tear. That's a very big spectrum. So there's some kind of partial tear here. So we're looking at the severity. Is it closer to 1 or is it closer to 3? And we determine that by strength. So if there's significant tear there, you're going to have a lot of weakness, and we can determine that by having them just go through the range of motion and see if they can just have the strength to contract that muscle themselves concentrically and eccentrically. And then after that, we can add resistance and see if they can resist us. And as you get into this as a clinician, you will understand these different grading systems on how we do manual muscle testing and resisted range of motion to better understand where we are on these strains. And that just helps us better intervene. So a grade 2, you're going to have that partial tear that's going to have some bruising, some loss of function. Sometimes they might have a limp. They're not going to be able to go full speed. Where a grade 3, they're going to have a full tear, significant loss of function, won't be able to weight bear, won't be able to run or jog, will have a significant limp and often need to be on crutches. So aside from strains themselves, other things that can happen to muscles are just soreness, cramping, and bruising. We're going to talk about these a little bit. So first, delayed onset muscle soreness. I don't have a picture of that up here, but DOMS is what we call it. Whenever you work out, you're having some breakdown of muscle so that it can build back up, so that hypertrophy. So you're going to have soreness. The covering of that muscle, sarcolemma, is going to be sore and have some inflammation, and that's where we get that delayed onset muscle soreness. The peak DOMS soreness is going to be about 20 or 48 hours after, so 2 days after, and it should slowly start to get better. That is normal and expected, but we should give that person recovery time to get the inflammation down before returning back. What we need to differentiate that between is rhabdomyolysis, which is not mentioned in the textbook, but something I wanted to bring to everyone's attention in here because it's common in CrossFit, or I shouldn't just sell out CrossFit. CrossFit is great, but it's common in any kind of form of exercises that push people to or beyond their limit. So if you have such significant breakdown that it can then break down and those contents of the muscle get into the bloodstream, it poisons the bloodstream and can negatively affect our heart and our kidneys. So some of the big red flag symptoms are tea-colored urine, which is not always present, but usually significant pain and or weakness. You can have a lot of pain and not necessarily the weakness, or vice versa, that is not necessarily present with just that muscle soreness after exercise. So for example, I had a good friend who had this happen after a CrossFit, and she had been a CrossFitter for many, many years. It was just a fluke thing, and she went into the next morning, couldn't even pick up a dish out of her dishwasher. It was just such significant weakness. She couldn't turn a doorknob or pick up her toothbrush. Something was wrong. She didn't have any changes in her urine, but she just had significantly high levels of creatine phosphate in her bloodstream. And so she became very close to actually dying from that. So it was so not all cases are that severe, but it's important to just recognize that this can not just be DOMS. If you get so significantly weak that you can't even walk or function, it could be getting to rhabdomyolysis, and you need blood work to determine that. So that's just a FYI for everyone there to make sure we're looking for that. Another thing is muscle contusion, and you can get a bruise to the muscle. Now remember, with a muscle strain, you can get bleeding and cause ecchymosis, which is discoloration that is bruising. discoloration, but that would be during the whole length of the muscle. A contusion is going to look like this picture here where there's an impact to the skin, and then the energy was dissipated around that and created that injury to the tissue. So we need time for that to heal. And there's a very specific protocol that we'll get into when we get to quad contusions in that specific module, because it can turn to myositis ossificans, where it calcifies, turns to something very, very serious. And then the last thing is cramping. Cramping can happen just from muscle fatigue, and it's usually from an electrolyte imbalance as well, that the muscle is not able to accommodate what it needs there. And so it starts cramping and spasming. So it's going to be very painful, and you're going to feel and see a visible cramp or feel that spasming happening under the skin. Typically, gastrocnemius and soleus in the calf are common areas for this to happen. Typically, cramping happens at the end of a practice or end of a game when we've had those electrolytes depleted, like calcium, magnesium, and sodium. Something just to real quick differentiate is that sickle cell anemia. Some people think that people were cramping when they go down with a sickling episode. This is when the people that have sickle cell anemia or sickle cell trait can have sickling of their blood, where their red blood cells turn to a crescent shape, and they're not circulating the way they should, not circulating oxygen. And so someone will have trouble breathing, and they will have more weakness than they will have pain, where cramping is more pain than weakness, and they'll have that visible spasm, where sickling will not have a visible spasm. And sickling is only diagnosed by a low oxygen concentration and has to be treated with given oxygen, and it has to be given very quickly, and it's a medical and life-threatening emergency. So there's very distinct differences. So I just want to make sure everyone understands that. Just don't assume that someone goes out grabbing their abdomen or their leg that they have muscle cramps, especially if it's at the beginning of a practice and it's hot out or they're at altitude, or things that could put high risk for sickling events. For this chapter and for your assessments, just please understand strains, understand muscle contusions, and understand delayed onset muscle soreness, and then rhabdomyolysis also, because I have that in the module. If you have any questions, please reach out.